Hello and welcome to World Cancer Day 2024, organized by Project Pink Blue. Every year, Project Pink Blue organizes this event to really create more awareness about, the importance of early detection, the importance of adopting great health-seeking behavior to make sure that cancer becomes a thing of the past.
And 1, and 2, and 3, and 4, and 5, and 6, and 7, upper body.
Once we get to the junction, we do another right turn. We now go straight up towards Federal Secretariat. It's 5.1 kilometers, it's not a long walk.
Basically, I'm here to trample on cancer. I'm not even walking on it. I'm not running on it. As I'm going, I see it and I trample on it.
Cancer is a dangerous disease. It takes people's life.
We're here to support the work against cancer.
I just came to also add my voice to what is going on, because cancer has really dealt with a lot of people.
I have so many friends who have died of cancer. Why? Because they detected it late and it was in the advanced stage, and it's not something I really want to talk about now, but it's the main reason why I'm here, so just to support them and to remember them that have died.
I know of someone who actually suffered from cancer, and it was not easy with regards to the finance and everything.
My grandmother was a victim of cancer, and unfortunately we lost her in 1998. And just recently, my aunt, my mom's elder sister, was also a victim of breast cancer, and she died 4 years ago. So you see why I am so passionate about this cause. Cancer no dey show for face, so until you get screened, you won't know if you have it or not.
My sister is a champion. She survived it. It was a very stressful time for us, being that it's something we hear about. It's not something when you have close contact, close experience with it, you will know how difficult it is.
As someone that works on a daily basis with cancer patients, I get to see these cases, the advanced cases, people with breast cancer, cervical, coming for support. It's very important that we do something like this so that we can raise awareness. Early detection saves lives, remind people to screen, remind them to speak up, make people aware that there's something like cancer so we can seek treatment. Cancer is not a death sentence. Cancer can be cured, but the only difference is at what stage do we find it and how do we know to check for it when we're aware. So this is very important, and I'm grateful to be a part of this cause.
Whatever the government has really said that they are providing is really not enough. There are a lot of vulnerable persons, children, most especially, and women. So government needs to intensify efforts and ensure that they really add up to whatever budget they have for vulnerable persons in our society.
There's so much stigma against patients that have cancer, and that is one thing I want this awareness to push for.
Honestly, the way we treat cancer in this country is abysmal. We need to do better. A lot of people are dying, and it shouldn't be so. It shouldn't be a death sentence. And we have a situation whereby access to good quality healthcare is dependent on the economic status of one's family or someone's economic status, and that's not fair. It should be accessible to everybody. And I love the fact what is being done today to create awareness and let us understand that there's no stigma attached to having cancer.
It's very, very necessary that people come together, even other institutions, like us, other organizations join Project Pink Blue in this wonderful cause that they've been championing, and see how far and how well we can impact the community where we live and work with positivity.
So our theme or our aim is to try to bridge that gap, to feed them with the knowledge that they need, to call on governments to provide, as well as other stakeholders like civil society, to provide the necessary treatment modalities, chemotherapy, surgery, radiotherapy, within equal access for all Nigerians.
The screening is still ongoing.
We want to beg that you come and have your screening. Early detection is one of the surest way to win cancer.
Please, girls, age 9 to 15, please go for your HPV vaccine. It's free. Human papilloma virus. The vaccine is at the screening checkpoints there, please.
I think this walk was an excellent event, well organized, thanks to Project Pink Blue and all of the stakeholders that are here. You know, if you are at a certain age, if you're a male, you need to screen yourself for prostate cancer. If you're a female, you need to screen yourself for breast cancer. You need to screen yourself for cervical cancer. You should also get vaccinated. There are vaccines that are very safe and very effective against cancers that are killing our people. We call out the human papilloma virus vaccine, which is now available free in 15 states and the FCT, and will be available in the rest of the states for free in May. That the government, thanks to the President Bola Ahmed Tinubu and the Minister of Health, coordinating minister.
Our specific ask today is that early detection, people always say that early detection saves life. That is true, but the reality is that it's actually early detection and treatment that really save life. Because the problem is that there are so many gaps that exist in treatment. In the whole of south of Nigeria, there is no government-owned radiotherapy machine that is currently working. The only radiotherapy there is actually a private-owned. So there is a need to close that gap. We currently have cancer centers in other places, but some of them are not working. Another call to action that we really need is that there is a need to decentralize cancer control. We are leaving cancer control only in the hands of the federal government. The state government need to take up action and protect their own people. We need cancer. We need the same way we have the National Institute for Cancer Control at the federal level. We need that institute at different state level. Today, many people are presenting late in Nigeria, and we are blaming the patient, saying it's the patient that are presenting late. But the reality is that the system needs to be fixed in a way it can help people to present early. Why can't we have a situation whereby once a woman arrives for antenatal, she's mandated by the policy of the federal government and the state government that that woman must receive breast examination, cervical examination. By that way, we can catch cancer early. We should not be waiting till symptoms arrive. That is when we start to screen. So these are low-hanging fruit that through policy, the federal government, the state government can really make an impact.
Thank you, everyone, and together we're going to close the cancer care gap. Together we're going to choke cancer.